Most people check their blood sugars randomly and panic. But the proper diagnosis of diabetes needs these three major tests to confirm a diagnosis and to have a proper treatment. Hi Andy, this is Dr. P. Ravi Kiran, General Physician and Diabetologist at ONUS Robotic Hospitals. Let's learn about the three basic tests for diabetes. The first test is fasting blood sugars. The next test is post-lunch blood sugars. The third one is HbA1c. Let's know about these three tests in detail. What is fasting sugars? Fasting blood sugars is a test when done on fasting implies the diabetes status. అయితే FBS collect చేసుకునే ముందు there are certain protocols which we must follow to get a correct value. The first and foremost thing is we have to have at least 8 to 10 hours of fasting. ముందు రోజు నైట్ మనము ప్రాపర్ స్టాండర్డ్ మీల్ తినాల్సి వస్తుంది, నాట్ హై షుగరీ ఫుడ్స్ ఆర్ లో ఫుడ్స్ విచ్ కెన్ ఇంటర్ప్రెట్ ఆర్ విచ్ కెన్ చేంజ్ ద వాల్యూస్. Take a standard food up to 300 kilocalories, 350 kilocalories of diet, followed by fasting blood sugars. That will give us the exact value. Value of less than 100 is normal. 100 to 126 is pre-diabetes. More than 126 is diagnosed case of diabetes. Post-lunch blood sugars. Post-lunch blood sugars are done 1.5 to 2 hours after you consume your standard food of 300 to 350 kilocalories. చేసిన తర్వాత బ్లడ్ షుగర్ ఎంత వస్తుందో చూసుకొని దాన్ని బట్టి వి ఇంటర్ప్రెట్ ద వాల్యూస్. లెస్ దాన్ 140 is normal. 140 to 180 is pre-diabetes. More than 180 is diagnosed case of diabetes. This is post-lunch blood sugars. The third value is HbA1c. HbA1c indicates the blood sugars present over the last 100 days. Because that's the lifespan of RBC cells, HbA1c denotes the blood sugar values over the last 100 days. The normal value is less than 5.7. 5.7 to 6.4 is pre-diabetes where the problem has already started. From 6.4 to 7, it's diagnosed as diabetes under control where there is a selective need for medications and not all patients need medications. But above 7, you're already diabetic patient and without control. So always remember, less than 5.7 is normal, more than 7 needs medications. Between 5.7 to 7, there is an urgent need for diet and lifestyle changes to prevent the need to use for medications. These are the three major tests. Why are these three tests needed to confirm diagnosis and why one test is not sufficient to diagnose diabetes? Let's discuss few case scenarios. First case scenario where the patient has normal fasting sugars but the post-lunch sugars are high and HbA1c is normal. This condition denotes pre-diabetes condition where the post-lunch blood sugars are high secondary to the insulin resistance and lack of the role of liver in controlling the sugars. In other conditions where the fasting would be high, post-lunch would be normal, HbA1c would be normal. These occur commonly in fatty liver patients where the liver is producing more sugars and causing more fasting blood sugars. So in early type 2 diabetic or fatty liver patients, the fasting sugars would be high, post-lunch would be normal and HbA1c would be normal. In some cases, the fasting and post-lunch would be high and HbA1c would be normal. These cases indicate newly onset diabetic conditions where the HbA1c has not still risen up, but the patient is already overtly diabetic. So in view of these multiple conditions, we have to have the proper fasting post-lunch HbA1c values to correctly diagnose a patient and to treat the patient. We at ONUS Robotics Hospital focus on diet and lifestyle changes and help you attain your diabetes reversal with the diet changes. And let's come together to control the diabetes epidemic in country and lead a healthy life.